And welcome back. Joining us is Dr. Wheeling of Orthopedic Associates of Meadville. Dr. Wheeling, it's a pleasure. Thank you for joining us.
Thank you for having me.
Let's talk about Orthopedic Associates of Meadville. Give us your history with this department.
Well, I have been with Orthopedic Associates for 10 and a half years. So I am not an orthopedic surgeon. I am a physical medicine and rehab physician who specializes in outpatient musculoskeletal medicine, and for the last several years I have been solely doing electrodiagnostic medicine for Orthopedic Associates.
Wow. Well, so break that down for us and exactly what you do and at what stage are you involved with patient care?
So my specialty is very broad. My first board certification is in physical medicine and rehabilitation, which is called Physiatry. And we are physicians who are educated in internal medicine, neuromuscular medicine, and musculoskeletal medicine. So when I finished residency in 1994, most of us were very generalists. So we take care of patients who have strokes and spinal cord injuries and head injuries and amputations. But part of our training is through all of our residency, we are trained in electrodiagnostic medicine, because in order for rehabilitation to be successful, your diagnosis has to be accurate. So electrodiagnosis is the diagnosing of neuromuscular, nerve and muscle injuries to make sure you're treating the right things. And the common name for electrodiagnostic medicine is if somebody has to come and have a test called an EMG or nerve conduction study. And there are really only two physicians who perform EMG and nerve conduction studies: neurologists and physiatrists. And our training is different. We as physiatrists get a lot of it during our residency, and we don't have to do a fellowship. At the time I finished, there really weren't fellowships to do. Everybody just specialized if they wanted to. Now physiatrists specialize in everything. You'll have the physiatrist who is the spinal cord physician, or the sports physician, or the amputee physician. And so my specialty over the last 10 years has really funneled down into the electrodiagnostic part of my specialty. And when I came to Orthopedic Associates, I did a lot of other things for the group. I took care of a lot of patients that didn't need surgery. But the dynamics of the group and the practice have changed over 10 years, and so now, as I am an aging physician, I am really just focused on the electrodiagnostic part of their practice to help them take care of their patients.
So when a patient hears EMG, I'm sure they have questions. What sort of questions do you hear from patients before they come to see you?
Well, they get referred to me by a primary care specialist or another specialist, such as a rheumatologist or a surgeon, who are looking for a piece of the puzzle as to why somebody is having the problem they're having. Whether it's pain, whether it's weakness, whether it's numbness, whether they can't walk. But patients don't really know what this test is or what it's supposed to show. So it's very easy to break down. It is really a test of muscle and nerve function, and what we try to determine is, do people have any signs of nerve damage, and if so, where? Do they have any signs of muscle disease? The test does not answer the question why somebody has this, but as a physician who does the test, we take the data, we say what the data shows, what conditions you most likely find it in, and then you help to direct the referring physician to the next step in their diagnostic workup.
So to me it sounds like if you threw out puzzle pieces in the past, maybe people were guessing where to start with the puzzle. It sounds like you're providing that good starting point of building that puzzle piece and getting those pieces together. It's a very important role in figuring out the care of a patient.
It is, and people come in with a lot of anxiety about the test because they don't know what to expect, and because the test on paper doesn't sound pleasant at all, because the test involves some small electric shocks, and we use a pin like an acupuncture pin in one part of the test. So people come in with a lot of anxiety. So a big part of the test is getting them through it without making them miserable and letting them know that they have complete control. So what we do in this test is we just put some rings on people's fingers, or we put some discs on their hands or their feet, We use some small electric shocks. It's not like sticking your finger in the wall socket. It's like a tap and a tingle. And that helps us get one piece of the puzzle. And then the second piece of the puzzle is the actual EMG, which is when we record the electric activity of somebody's muscles. It's just like doing an EKG of the heart. We look at the same electrical activity that the cardiologists do. And just like they can say, oh, you've had a heart attack or you have AFib, we can tell if people have nerve damage or muscle disease. And as we talk people through the test and keep them calm, most people get through it without any difficulty at all.
When you see a patient, we've said before, talking with several guests, that here in Northwest Pennsylvania, people seem to work hard, play hard. They put their bodies through a lot. What sort of things do you see from patients that would cause nerve damage or muscle injuries?
Oh, all kinds of conditions, and that's what makes this so interesting. Every case is different. We'll see people who come in for a referral to know whether they have carpal tunnel syndrome, whether they have a pinched nerve at their neck, nerve irritation from their low back, whether they have weakness that can't be explained. And it's not about why does somebody have pain, or we can't tell them by the test if they have arthritis or tendonitis. We'll only be able to give them the nerve and muscle piece, but we really help to direct the physician, because we can say what it is and what it is not, and that's the piece of the puzzle that the referring physician needs.
But it sounds like that part of it could be a big relief to a patient, maybe suffering for a long time or trying to figure out what's causing pain or discomfort. Again, going through the tests and getting an idea of, okay, what's next. There is an opportunity to discover what's next by going through this process.
Absolutely.
This sounds like a very unique part of a patient's care in this department. I would imagine that it takes special certification to be able to do procedures like this.
It does, and that's what's very interesting. I said only neurologists and physiatrists are allowed to sit for the board exam for electrodiagnostic medicine, and there's a board called the American Board of Electrodiagnostic Medicine. So we are the only physicians who can become board certified. Unfortunately, in the state of Pennsylvania will allow non-physicians to perform this exam. They will allow chiropractors, physical therapists to do this exam. A lot of EMG labs have technicians who do some of the nerve conduction studies, but not the EMG, which is the part with the acupuncture pin. But the state of Pennsylvania, with minimal training, will allow non-certified people to do this exam. What they're not supposed to do is give a diagnosis, because they certainly are not trained to do that.
Wow.
Our goal is to educate referring physicians about the difference in the quality of the exam and the diagnosis as it's performed by a physician who went through this board certification process. So not only do we become board certified in our clinical knowledge, but we also have a process of having our labs become certified by an organization called the AANEM. It's like the way Medicare certifies the lab you go to get your blood drawn, and you know that you are receiving standard of care and that people are trained. So I have the privilege of having the only AANEM certified lab in northwestern Pennsylvania, because you have to have a board certified physician in charge of your lab. So you can be board certified in other specialties, and say you've had training in EMGs and you feel comfortable in doing them. You can do them in the state of Pennsylvania, but your lab can't be certified if you're not certified by the American Board of Electrodiagnostic Medicine and the AANEM. So I've gone to a lot of educational trials and tribulations to have all those certifications, and I'm proud to say that I think people receive a very good study and they receive good care when they come to our offices. So
when a patient is visiting their doctor and they say, yeah, we think the next step is an EMG, it's important to, as the patient, to say, okay, you know what, we want to see somebody who is certified. It'd be better for me as a patient to go through that process.
Absolutely, because you might go to somebody who's not certified, you get the wrong information, you have to go through the test twice, or you get misdiagnosed. And I've certainly seen many of those cases over the years.
And a lot of times patients are looking for, I don't say quick relief, but maybe they're frustrated because they're trying to figure out what's wrong. This just adds more time to it if they go the wrong path instead of maybe going this direction, and again, working with somebody who is certified for this.
That's correct.
So, kind of, and I want to just touch upon some of the things you mentioned earlier, the rehabilitation process. How do they get to you? Is it going through their primary care physician? Is it somebody who's going through rehabilitation? How do they come to your offices and begin the process?
They come to me by referral from, they've gone to another physician with a problem, and the physicians are educated onto what the diagnostic steps are. So it is truly the physician who says, well, I think the next step is that in order to determine whether you just go to physical therapy or whether you see a surgeon or if we have to send you for specialty care, is we have to get this piece of the puzzle. We have to get the data from the EMG and nerve conduction study. And when we do this study, it really is a consult to the physician. I review the patient's medical history, I do a physical exam, and the EMG is truly an extension of the physical exam. By the time I'm done looking at their medical history and examining them, I have an idea of what we're looking for. And the purpose of doing the test is to confirm that or rule it out. And so at the end, I can say to the physician, this is the diagnosis that fits their medical history the best. And you can follow these paths. And so for the physician, it really is another consult on this patient.
I keep thinking, just patient care and what you get with Meadville Medical Center. Again, it sounds like it's another piece to this healthcare system that's constantly changing, technology, how it's changing. How has technology played a role in EMGs, and what's changing year to year?
That's a very interesting question, because when a patient experiences this test, they often say, oh, technology is incredible. I can't believe we can do these type of tests. The test has been around for a very long time. The first introduction to EMG began in the 1920s when they were looking at people with muscular dystrophies. It became used clinically in the 1950s, and it was really when they were looking at a lot of veterans from World War II who had nerve injuries and trying to come up with prognosis. So the early studies were done just using oscilloscopes, and I trained with a wonderful gentleman, and when we went through our residency, even though computers and computer-aided tests were available, he wouldn't let us use them for the first 2 to 3 years of our residency. We had to use the old oscilloscopes because he wanted us to understand the mechanics of the test and the electrical properties of the test. So computers aided us in generating very nice reports, and we didn't have to do things like change the filters on the oscilloscopes and all of those type of things. We certainly didn't have to handwrite reports. But the data itself, the ability to record the data, has not changed much. And believe it or not, they keep looking for new tests to get this same data. They're trying to say, can we get this without making somebody uncomfortable, without shocking them or poking them with an acupuncture pin? And so far, the answer has been no. They find other tests that tell us about structure, like ultrasounds and MRI, but it doesn't tell us about nerve and muscle function. So I'm sure there may be something in the future with the way artificial intelligence is going, but for right now, the technology just helps us maybe move people in and out a little more quickly, generate reports more quickly, and make it a lot more visually pleasing than it used to be.
I'm sure you find yourself out in the community and overhear a conversation like, oh yeah, I think I got a pinched nerve here, or oh, I think I've got some back pain I'm living with. Do you ever just stop and think, or maybe you've said to somebody like, we can help you with that?
Well, yes and no, because you can't really give your opinion because you become obligated to somebody. So we often just direct them to say, well, you really should consider telling your doctor about that condition because there are ways they can help you diagnose it. So I try not to put my 2 cents in where it's not needed.
But you're certified, so that's...
Once they come through my door, I have license to be critical and tell them anything I want about their medical condition.
That has to be a great feeling, though, knowing that you've helped somebody. Maybe somebody has been struggling with pain, discomfort for quite a while, and now they have a path that they can follow to get better, to get help, and maybe even if it just helps them a little bit, the comfort you're providing them is, you can't put a price on it.
It really is very rewarding, and I do understand that I have a unique set of skills that a lot of physicians don't have because they did not follow the same path that I followed. And it's actually what makes thinking about retirement difficult because they do such a good job in making us guilty as we go through medical training that I realize there are not a lot of physicians stepping up and following this path of medicine. So I do feel an obligation to the community and the patient to be able to keep doing this.
And especially when it's a certified lab and you put that effort into making sure that everything is above board, across the board, that the time and effort has been put into this, and again, the patient's going to get the absolute best quality of care by going through this department.
Yes, I agree.
All right, Dr. Wheeling joining us here, and we appreciate your time. If folks have any questions, want more information, they want to get to you, is talking to their primary care physician first?
Yes, and making a referral to Orthopedic Associates. We have a little handout about the study, and I talk to patients before we do it, so nobody goes through this test without knowing what's going to happen, and I don't put anybody through anything that makes them so uncomfortable that they're anxious.
Dr. Wheeling, it was a true pleasure.
Thank you.
All the best.
Thank you.
Dr. Wheeling joining us from Orthopedic Associates of Meadville. And thank you for joining us.